Good afternoon, everybody. Thanks for joining us today. My name is Dr. Ina Fishman. I'm the Chief Clinical Officer for Gateway Health Plan. With me today is Ryan Paul from my team. Paul Ryan was unable to join us today, unfortunately, so Ryan Paul came in our place. I want to thank you for allowing Gateway to show our support for Senate and House Bills 200, which would add postpartum depression as a qualifying condition to facilitate access to early intervention programs. At Gateway Health, which is a Medicaid, Medicare, managed care plan, we see the firsthand effects of postpartum depression on the moms and the infants that we serve. Usually I'll share a story of a member, but fortunately for us today, we have two very brave women, Kim Manfredi and Jatnelli Gonzalez, who are going to share their personal stories with postpartum depression in a little bit, and you'll really hear the powerful impact it's had on not just moms, but on the babies and the families as well. Studies show that 15% of women can experience depression in the year following birth, and the results can be really devastating and debilitating. Left untreated, postpartum depression can interfere with mother-child bonding and cause numerous family problems. Even when treated, postpartum depression increases a woman's risk of future episodes of major depression. And for dads, it has a ripple effect as well. Independently, dads have an increased risk of postpartum depression in a sense, and then the mom's challenges with depression makes that even more risky. Children of moms who have untreated postpartum depression are much more likely to have emotional and behavioral problems such as sleeping, eating difficulties, excessive crying, as well as attention deficit disorder. There are very commonly seen delays in language development as well as other behavioral issues. Many of these problems can be mitigated if postpartum depression is identified early and interventions occur promptly. I appreciate being here to voice Gateway's support of these crucial bills, and I'm proud to be among the distinguished group of supporters. This legislation provides life-changing screenings and services to infants and moms at the earliest point possible. This is really key because effective treatment is available. Therapy may include counseling and/or medication. Early intervention means early resolution. Most importantly, it breaks down the barriers to conversation and begins to remove the stigma surrounding postpartum depression and other behavioral health issues. With that, I'd like to introduce our esteemed guests here. We do have one person, Stephen Diachilli of the Alexis Joy Foundation, that was supposed to be here, was unable to join us today because his daughter is ill and he is staying home to care for her. But with that, I'd like to introduce and thank Representative Tarah Toohil, Representative Mike Schlossberg, and Senator Camara Bartolotta, and commend them for their remarkable commitment to moms, babies, and families across the state who have been affected by postpartum depression. And thank them again for their leadership and dedication in introducing these bills and moving them forward. Thank you, and I hope everyone has a wonderful day as we continue to work together to improve the lives of the moms, babies, and families that we serve. Representative Toohil?
Thank you, Doctor. Thank you to all present today. Good afternoon, my colleagues from the House and the Senate. Thank you for coming together to discuss something that is talked about very few and far between. Something is with a lot of stigma associated to it, and people don't want to talk about it. So I do want to give a special thanks to our two mothers that are here with us today on the stage, Jatnelli Gonzalez and Kim Manfredi, because it takes a lot of guts to come forward and for them to talk about what they're going to talk about with today. And the real story, they're the ones that you're really going to want to hear from. The real story is what makes a difference and what makes other people able to come forward and speak out and prepare and identify this type of an issue. So we're going to talk about the baby blues a little bit, and I wanted to go over some of the statistics. The doctor touched on a little bit of it, but research by the American Psychological Association does show that 15% of new mothers suffer from postpartum depression. And here in Pennsylvania alone, 21,000 babies and their mothers were annually affected by this disorder. According to the Academy of Pediatrics, a baby's brain development can be adversely affected when a mother is suffering from PPD or postpartum depression. Likewise, there is an increased danger for child abuse and neglect, which increases the cost of providing medical care to both the baby and the mother, and as well as many other adverse reactions. Our legislation, and originally this was championed by Rep. Mike Schlossberg in House Bill 200, as well as Senator Camara Bartolotta's companion proposal. And Senator Judy Schwenk could not be here today, but this is something that she's also worked on extensively. This legislation is simply adding postpartum depression as an at-risk category for early intervention screening and tracking under our existing state law, which is Act 212 of 1990. This means if a new mother is determined to be at risk for depression, her infant would be eligible for screening and follow-up tracking through the early intervention system. If the child demonstrates a developmental delay in the screening process, then the child would receive follow-up early intervention services to ensure that they are meeting their developmental milestones. Our current law provides for screening and tracking for infants with qualifying health conditions or those who are born in a certain high-risk circumstances. And these are children whose birth weight is under 1,500 grams, children who spend time in a hospital neonatal intensive care unit, children who are homeless, children born to chemically dependent mothers who are referred by a physician, and they have to be referred by a physician, healthcare provider, or parent, children who are seriously abused or neglected, and children with confirmed dangerous levels of lead poisoning. So those are the only children that are right now able to access these types of services. And this bill is going to be very important in opening that door for those 21,000 newborn babies here in Pennsylvania and granting them access to those services. So we want to thank Gateway Health Systems, who has joined us today. Also, the attention that American Academy of Pediatrics, Nurse Family Partnerships, and the National Coalition for Maternal Mental Health have all brought forward in talking about postpartum depression. And we've been making great headway on this bill. Thanks to a lot of people. Denny Civics Solutions has been working very hard on this piece of legislation in the House and the Senate. We were able to get the bill out of Children and Youth Committee in the House, and it was voted on the House floor, and it's been basically sitting in appropriations. So all of your attention to this, the women that are visiting, mothers that are visiting in the Capitol today, it's very important. The squeaky wheel gets the oil, I guess, as we say. And so we're glad that people are bringing a voice to this, and we are hoping that this bill moves quickly and moves this session so that we can help these moms and babies. So if you can put on your social media, we're all gonna promote it and say #StrongMom, and keep this conversation going. So thank you for your time with this, and we're excited to hear from my colleagues as well as the mothers. Thank you.
Thank you, Representative Toohil, and good afternoon, everyone. My name is Mike Schlossberg, State Representative for the 132nd District, and it's my pleasure to be the prime Democratic sponsor on this piece of legislation. I do want to thank all of you for being here, everyone behind me, but in particular, Kim and Janelli. What I have found in this arena as we talk about mental health is there's nothing more important than sharing a personal story. And sharing a personal story is an incredibly difficult thing to do. And it takes a lot of bravery for somebody who's never spoken on this issue to talk before, and I'm so grateful for their assistance in moving this piece of legislation. We know when it comes to postpartum depression that 70% of new mothers who are screened as at risk for postpartum depression ultimately don't receive the services that they need. This can have devastating effects on the mother and on the child. We also know, unfortunately, that when it comes to programs like early intervention, all the resources are not there, and this has a disproportionately negative effect on those in society who need the help the most, the poorest, those who maybe don't have regular access to health care. That's why this piece of legislation is so important. We know for a fact that the early intervention program can do amazing things for at-risk mothers and at-risk children, helping them rise out of poverty and live full and complete and healthy lives. But postpartum depression, when severe enough and when left unchecked and untreated, can have a dramatically negative impact on the life of a mother and on the life of a child. A baby's cognitive development can suffer dramatically. A mother's emotional fitness can suffer dramatically, and it can ultimately impact both of those individuals' lives for as long as they are alive. We know that postpartum depression can be treated. We know that depression and mental illness as a whole can be treated. And that's why it's so important that we help mothers and children in the early intervention program be screened and then treated for postpartum depression. 3 points, broadly speaking. First, the reason that I think this legislation is so important is we have a shared obligation to each other. If we fail to fulfill our societal obligation to those who have the least and to those who are most vulnerable, as a mother and a child suffering from postpartum depression are, we're not doing our job as legislators. That's why this legislation is so important. That's why it's attracted such strong bipartisan support. Second, I want to say it again because it really bears repeating, we need to take care of those who have the least. This bill will help ensure equity in terms of postpartum treatment by allowing those who have the least to have access to the same level of access to those who have the most. And third, I really want to make sure we're talking about this from a stigma perspective. As we know, a huge chunk of those who suffer from mental illness don't have access to the health care that they need because they are afraid or they are ashamed. They think that it's just in their heads, that they can tough it out. Mental illness doesn't work that way. If people realize that postpartum depression is real, it's a serious disorder that can have a huge negative impact on somebody's life, if we can convince those people to seek the treatment that they deserve, we can improve their lives. We can improve their children's lives, and maybe even in some cases save their lives. So with that, it is my honor to turn the microphone over to a real champion for mental health and postpartum depression, Senator Barlotta.
Thank you all for being here. Not a lot more can be said than what has been said, but it is such a multifaceted issue affecting children for a lifetime, truly, if it's gone unchecked. We've all heard stories about orphans in Russia or in China who are left alone in a crib or a playpen for days, just being bottle propped up. No human interaction, no tenderness, no showing of affection for those infants in their earliest developmental stages. That impacts a life forever. A lot of women who are suffering from postpartum depression find it incredibly hard to make that connection to their infants, and not just a stigma of, oh, I'm a horrible mom, but just the shame that goes in with that, and then it spirals, and it continues, and it gets worse. If we can catch these groups early on, right in the beginning, it opens up possibilities for development for these infants and children, and a connection with the moms and their infants, and thereby creating a much better emotional support system for the moms, the infants, and their whole family, and the community. Because a lot of us run into moms who may be suffering from postpartum depression. We don't know. They're good at hiding it, but they're suffering in silence. So this is a way to open up the discussion, to let these moms know, look, there's help for you, and we want your children to flourish. And there are programs available at the early intervention stage that will help these children who show signs of an issue with development and developmental delays. We can catch them before it gets much more severe. And my thanks goes out to all of the organizations, the advocates and colleagues who helped make this event a reality. Also, I offer special thanks to my constituents from Washington County who made the trip to Harrisburg to be with us today. The two wonderful ladies that you're going to be hearing from in just a moment. And it's fitting that this event is just a few days before Mother's Day, a time when we recognize all of the hard work and contributions of moms throughout the world. There's an old adage that a mother's work is never finished, and in my experience, those words definitely ring true. Even now, when my own children are grown and embarking on lives and careers of their own, I still feel the same familiar pull to ensure that every one of their needs is met. That intense need to love and nurture our children is something that lasts forever. And it is never more important than when a mom first comes home from the hospital with a new baby in her arms. It is a time of constant worry, incredible responsibility, and precious little rest. I still stay up nights. My kids are 26 and 23. Sadly, for thousands of these new moms in Pennsylvania and millions throughout the world, much of that joy and happiness of that critical time is sucked away by unshakable feelings of despair, depression, and helplessness. For some, these feelings go far beyond the typical baby blues that many new mothers experience. Postpartum depression robs families of what should be one of the happiest times of their lives. It creates significant threats to the well-being of both the mother and the child. The first few years of life are the most critical time for a child's overall health and development, and anything that gets in the way of that process can create serious consequences later in life. To make matters worse, many moms affected by this condition refuse to seek help because of the stigma attached to mental health issues. These concerns are a big part of the reason why I introduced Senate Bill 200 along with Senator Judy Schwenk that would help identify moms and babies who are at risk due to postpartum depression and ensure that they get the resources they need to overcome their condition. We already have a system in place to monitor infants who suffer from concerns related to their health and their living environment. My bill would add postpartum depression to the list of conditions that qualify for monitoring and ensure all families get the help that they need. With the tireless support of the Strong Moms, Strong Babies initiative, I am confident that we can see action on this bill and the legislation sponsored by Representatives Toohil and Schlossberg in the near future. One thing is certain, we will not stop fighting until we see this legislation signed into law. 1 in 7 new moms is affected by postpartum depression. The stakes are too high and the consequences too severe for us to give up now. I appreciate everyone making the trip to Harrisburg today. Even though Senate's not in session, I wouldn't have missed this for the world. So thank you all for being here.
Hi. Thank you all for this opportunity to speak today on a topic that is dear to my heart and has become a passionate part of who I am today. It's never easy to share my personal story with the struggle on postpartum depression, but it is something that I do in hopes that I can open up eyes and hearts to bring understanding and awareness. So today I'm going to share with you what it was like to battle postpartum depression, the fallout, and those that are affected, and why I support Bill 200 and why we need you to support it as well. My name is Kim Manfredi. I'm with Postpartum Depression Project, a support and advocacy group in Washington, PA. I have 4 children, ages 25, 18, 16, and 8. So you take me back about 8 years ago, 2009, to my 4th child. My first and only battle with postpartum depression. It was terrifying. It was a dark struggle that almost enveloped me completely. My symptoms were on the severe end. And it's important to understand that every mother will experience postpartum depression differently. Postpartum depression is also known as a perinatal mood and anxiety disorder. And we've already gone over the statistics, so I'm just going to pass that up. For me, I refused to believe that I had it, which delayed me from getting the treatment that I needed. I didn't have it with my other 3 children, so how could I have it now? I equated having postpartum depression with wanting to hurt my child, which was not the case and just shows the lack of education and understanding that I had at the time. I had no previous experiences with mental illness or depression. And the biggest lie that I told myself was, I can handle it. I can tell you I didn't handle it well. It damaged my relationships, and it damaged my child's start in life. While it's still difficult to talk about, I was constantly sad. I was easy to anger. I was oversensitive. I was in and out of irrational thinking. I had anxiety. I didn't sleep well, and when I did sleep, I had terrible nightmares. It felt like I lived in a glass box. I could see the world around me, but I couldn't touch and I couldn't feel it. I felt completely broken and hopeless, like a stranger to myself. I was embarrassed. I was filled with guilt and shame for not being good enough for my family. I wanted the pain, the thoughts, the feelings, and the suffering to end, not just for me, but for my husband and my children. They deserved a happy, unbroken wife and mother, and isn't that what we expect after having a baby? Shamefully, I didn't see any way out of the darkness. I attempted suicide. I never planned to see or feel another day, and I call this time in my life my successful failure. During my brief stay in a psychiatric ward immediately following my failed attempt, I was assessed by a team of doctors, put on medication, and returned home with the additional counseling. I was educated and no longer had the option to deny that I was suffering with postpartum depression. I recovered. I came off the medication successfully. Treatment saved my life. No mother should lose her life, and no family, husband, or child should ever have to live with that unimaginable forever loss. I can't yell loud enough. Education, treatment, and recovery. While I'm a survivor of postpartum depression, I'm also a voice to many that didn't make it here today to feel this day with us. The stories and the articles that I still read, they enrage me and they break my heart. The senseless loss of lives over a treatable, temporary, and recoverable condition that desperately needs attention and action. The effects go beyond just the mother. This is a family issue, and it's a community issue. So when our son was about 3, we started raising concerns with our pediatrician on his delays. We were given a referral to early intervention. They came to our house, they did an assessment, and they started speech therapy, adding and adjusting services as needed weekly at times and days that were good for us. The therapists and the case managers were amazing. My son is in 2nd grade now. He's on an IEP, and he recently completed and tested out of occupational therapy. He's reading close to his peer level and not far from meeting all of his speech goals. But would he even be struggling now if I had gotten the help I needed sooner? So we know that there's, significantly higher risk of learning delays, cognitive behavior issues, and stuff like that. And it's so important that both mom and child, they get the help and support and the guidance that they need early. So House and Senate Bill 200 is a great way to navigate these mothers into getting that help that they desperately need while addressing the needs of the child. And a few things that I want to point out is how the House and Senate Bill 200 will apply to a mother with no cost. It's going to give the mother a system that regularly checks in on her, inadvertently bringing the mom out of her withdrawal. She may take a shower. She may do her hair. She may tidy up her house. And most importantly, she'll be educated on how to help her child, and this can give her hope and light in a time that seems so dark and endless. House and Senate Bill 200 is a win-win. The systems are already in place. We just ask that you extend this to include the children of mothers suffering with postpartum depression. And when we talk about costs and budgets, we really need to put in perspective here that if at 8 months old my son had early intervention services following my failed attempt, would he be needing the resources now of 3 special education resource teachers over the last 3 years? So I want to ask everyone here seeing and feeling with me today to support Senate Bill 200. The struggle of postpartum depression is real and it's hard, but there is help, treatment, and recovery. It is essential we continue to diminish the stigmas, establish best practices, and further the understanding. Jet and Ellie and I hope you leave with a better understanding on postpartum depression and a strong commitment to keep the conversation going and stop the shame. Thank you.
Hello, everyone. How impactful is Kim's story, right? My name is Jetnelly Gonzalez. I'm with Postpartum Depression Project, and I'm here to share my experiences with postpartum depression. Childbirth is one of the most fulfilling and joyful days in a woman's life. However, not every mother gets to experience that. In 2010, I experienced postpartum depression for the first time. I remember the first time they placed my daughter on me. I had waited anxiously for this moment for so long. I had so many expectations, so many plans. But as I lay there with my daughter on my chest, instead of feeling joy, all I felt was this deep sadness that consumed me. I'm a horrible mother, I thought. I was scared and embarrassed to tell anyone how I was feeling. Instead, I chose to pretend everything was okay. But deep down, I felt like I was drowning. I saw my OBGYN later on, and even though he initially thought it was the baby blues, he prescribed me medication. Sadly, I only took the medication for about a week because I became concerned on how it would affect my baby because I was breastfeeding. My doctor never followed up with me, and I had nobody there to guide me through this. No one told me I should seek help from my counselor, so I went untreated because I thought I could overcome this alone. However, soon I realized that I was wrong. I felt guilty because I wasn't bonded with my daughter, and I felt like a failure because I wasn't coming out of what I started to call the funk that I was in. I was in complete denial. I started to think my daughter would be better off without me, which led me to constantly fantasize about running away and leaving her behind. I just wanted to run away and escape my painful depression. I felt so hopeless and so alone. So 3.5 years later, I had just delivered my second daughter. And for a moment, I thought I had dodged the bullet on postpartum depression because this time it didn't hit me right away. I knew that experiencing postpartum depression a second time was possible, but what I didn't know was just how high that possibility was. Women who have experienced postpartum depression once are 50% more likely to experience it again. This time, however, I knew I needed help before I went home. By this time, I didn't want to fail my daughters, so after talking to my doctor, he prescribed me medication. And I also started seeing a counselor right away. And I'm so glad I did, because this time my depression was more severe. I was constantly crying. I couldn't sleep, I couldn't eat, I couldn't function properly. I remember just a couple of days after coming home from the hospital, I thought about ending my life. I considered taking all the pills the doctor had just prescribed me. Thankfully, my husband was there and he talked me out of it. I thank God every day for his support because a support system is key to the recovery of postpartum depression. So at around 6 months postpartum, I was back to feeling myself again, and I noticed my daughter was not rolling over yet. I talked to her pediatrician, and we contacted early child intervention services. They came, evaluated her, and she was indeed 30% delayed, but not enough for physical therapy. They sent a therapist home, though, for a one-time session to teach me exercises that I could do at home with her. It was so helpful. It gave me so much hope. We did those exercises, and before we knew it, she was right where she was supposed to be. Sadly, I didn't know until I started doing my research on postpartum depression of the cognitive and developmental delays it can have on babies. And with that being said, I know firsthand how postpartum depression can affect the mom and the baby. And I can't stress enough for mothers to seek treatment and follow through with it. And for health professionals to screen, treat, and follow up with the mothers. Mothers need to know they are not alone and that there is hope. I also want to highlight the importance of supporting Senate and House Bill 200. Because if postpartum depression affects up to 50% of women, that means that also 15% of babies, infants, are at a risk for cognitive and developmental delays. Senate and Bill 200 would ensure those infants to automatically qualify for early intervention services once the mom is diagnosed, so that any further delays could be prevented early on. Thank you.
Thank you, everybody. I just want to ask one more time to really show support for our two moms, Kim Manfredi and Jetnelli Gonzalez, who were so brave in telling their story today. And you heard how powerful and impactful postpartum depression can be. So one more time, a round of applause for them. That concludes our program. We're really appreciate everyone's support for being here and support for the bills. We'd be happy to answer any questions you might have, but once again, want to thank you and thank our moms for their courageous presentations today. Thank you, ladies.
I do have a couple of questions, specifically about the screening process. So you guys mentioned, once a mother is put into that at-risk category, postpartum depression, they can be, brought into the early intervention program. But how does that initial screening happen, and how does that initial referral?
So there are a variety of tools. One of the nice things about this bill is that it's not proscriptive on the how. So what we're really trying to do, there's a lot of evidence. The College of OBGYNs and Academy of Pediatrics have provided many, many tools that are available to primary care clinicians as well as OBGYNs to screen for postpartum depression. So there are many standard tools that are evidence-based, and the goal is to get that screening done either in the hospital, immediately postpartum, in the OBGYN's office at the postpartum visit, or at the first visit at the pediatrician's. So any tool that's evidence-based can be used. And once you do that screening, you come up with the risk, then you can make the referral to the program. So this bill is as flexible as possible in giving physicians and other clinicians like midwives and others that care for our moms and their babies the ability to do the assessment real time in whatever setting is best for the patient and the doctor together, the clinician together, so that they can make the referral to the program. So there's a lot of flexibility here.
And so several states have made these screenings mandatory. Why not go that route?
Personally, putting on my personal physician's hat, I would tell you that mandating things is not necessarily the most effective way to get results. You have to want to do it. You have to educate physicians, you have to educate moms and families about what the issues are. And so when you tell people they have to do something, sometimes physicians can be a little annoyed about that. I would hope we're not, but the reality is that when you have a mandate, it can sometimes become a barrier to the actual action that you're looking for. So this promotion is about education, and we have the specialty societies that are supporting it, right? So they're providing the tools, and you have to be flexible. When you have a mandate, it's usually a very rigid process. In this case, we want to be as broad and flexible as possible so as many moms and babies can get assessed and get treated. So I know perhaps our legislators would comment more on the mandate piece, but from a clinical perspective, it's not always the most effective tool to get to the desired outcome. We want to make sure our clinicians understand the criticality of this issue and why it's important to be just another piece of that doctor-clinician relationship so that it's a routine process and it doesn't have to be mandated. I don't know if any of you want to comment on that, but.
You got it.
Yeah, and we may be making it just a testing period too, just to get it across the goal line.
What do you mean by a testing period?
Just,
Because there's some confusion in appropriations to how much this may cost, based on the number of women diagnosed, based on those children they're not all going to be developmentally delayed. So we're discussing exactly how much this may be in the appropriations process, but in order to at least get the ball rolling and get it out there as soon as possible, this may end up being just a test period for a small area. So we're working with the appropriations to make sure that those numbers really coincide with what's real.
And so the test period, would that be like a regional test period, or and would it be for a certain amount of time? Has that been established?
Well, I mean, we're still discussing those possibilities, but I would love to make this something mandated across all of Pennsylvania. But again, to the doctor's point, when you mandate something, again, it narrows the focus too much, and that may not be a large enough safety net to catch everyone involved.
And I did want to ask about the cost. I do have another question about the screening, but while we're on it, the cost. I mean, have you guys come up with numbers, and where would those, expenses be coming from?
Well, there is a line item for early intervention already. To add one more category to that list, we're debating a little bit in appropriations as to exactly how much that's going to be. And I think we're honing in on a more accurate number. Again, one group was thinking, oh, okay, well, if there's that many moms out there every single year diagnosed with postpartum depression, then of course, all of those children would be affected and fall into this category, which is not the case. It's a percentage of that, and then it's 0 to 3 years, and through attrition, some of these kids graduate out of a program. They've been caught early, and they've reached their cognitive developmental benchmarks as they should. So there's some moving parts in it.
Would you be able to share the numbers that you're honing in on?
Well, again, unfortunately, the Senate's not in session this week, so they're not meeting in approbes, and we have those figures at my office, and we're still trying to get a more accurate number.
Okay.
Just to
Are there numbers in the House?
Yes, that's what I was going to say. The House fiscal note came back at $900,000. And I think, if I'm remembering correctly, the Senate fiscal note was higher, and we had some concerns about it.
Right.
Okay.
So the Senate fiscal note that had, as you said, included too broad of a swath of
Exactly.
people, and the House was more targeted, I would assume?
Yes.
Yes.
Yeah, the $900,000 was in line with what we actually thought the cost would be.
And then for the screening, maybe this is a better question for the physicians. I mean, how is there going to be a component where doctors are educated about this, told that this is now something that they're expected to do? Because I had read, and I think this goes along with what you were saying, that often screenings are additional time for doctors. They're costly. They have to print stuff out. And so sometimes people, if they think they're not necessary, they don't do them. So, is there something where doctors are going to get additional resources or something?
It's hard to comment on the resources piece, but
Maybe not resources, but just materials.
no, I understand. I think there's a lot of education from a broad range. One of the reasons why Gateway is involved is because we have relationships with the physicians that are treating our members in particular, as well as other members, and we're part of a consortium across the state. So all the health plans would be engaged in that. The specialty societies are going to be involved in that. The advocacy groups are going to be involved in that. So yes, there's even, in fact, the American College of OBGYN just met this weekend and did a lot of presentations on postpartum depression and educating their staff. So, and most physicians now actually use electronic health records, so a lot of this screening is embedded. And it doesn't have to be done by the physician. That's the other piece that you have to remember, that usually, and I say healthcare is a team sport, right? Because there are a lot of people that are engaged in providing services to patients. And so this kind of screening could actually be done by a nurse or a medical assistant or the midwife or other people on the healthcare team. And the results brought to the physician for a decision. So incrementally, I don't see it as a huge impact or lift in the clinician's office, because a lot of the screening occurs by other people on the team, right? Your blood pressure, other questions, demographic information. So this is just another data point that's collected to help the clinician best manage the patient. So there are a variety of ways to do it. And it really is not, the tools are very, very simple. They can be as simple as 2 or 3 questions. They can be more broad if there's a suspicion that there's a deeper problem. But a lot of the screening tests are really no more difficult than many of the other questions we ask. Do you smoke? Do you drink alcohol? Things like that. Other areas that we want to identify as risks for the patient. So it really shouldn't be difficult. And there's, as I said earlier, the OBGYN Academy, the Academy of Pediatrics, the managed care organizations and other insurers, are all aligned on this to make sure that those tools are available to the clinicians.
And I would ask that just to the legislative side. I kind of read through the bill. There's nothing really on clinicians. You pretty much leave that part open. But once people are referred to this program, that's what you're concerned with. Okay, great. How long has the bill been in approach at this point?
I believe in the fall session,
Okay.
we put this out, but it was our second term
Yeah.
with the bill. So Senator Bartolotta and Senator Schwenk and Representative Schlossberg had this, it would have been in
Previous
the
session,
previous
yeah.
session.
Yes.
Yes, and then we had two different fiscal notes on the legislation. One in the Senate saying a high amount and then a lower amount.
What session you had that?
It's been,
I don't think
I
we
guess
had
that's from this year.
Yeah, we didn't have a fiscal note last year, so I'd never made it that far.
So, but that's, obviously, that's part of it. And then as these children grow up that have been treated, there would be cost savings there, and that's really hard to get a number on. And we're saying, hey, 5 years down the road, we're gonna have this cost savings. But $900,000 is really kind of like chump change around Harrisburg in this Capitol building. So it's something that I think all of us are in agreement that if we make that investment now, it's going to be wholly preventative for a lot of these children and help their families.
And coming up with the 900,000, was there any number on like how many women and children that would be treating, or I know it seems
Don't
like
have that.
Well, if there's 21,000 babies annually,
in Pennsylvania.
in Pennsylvania alone, many would decline treatment. And right now, many doctors, I'm an adoptive mother, so I've never been through this, but even as an adoptive mother with my newborn, the doctors do go through a list of questions. And that's something that's really positive about the mothers speaking today and raising awareness, is that when you're in front of that doctor, in front of the pediatrician, you're trying to, you've had a lack of sleep, you have a lot of things going on, and you're trying to act normal. So when they're asking you questions, you're like, oh geez, like, why do I look like I'm, like when they were asking the questions, I was even thinking, oh my goodness, like, no, I'm fine. And now I think a mother that's not feeling fine would be much more apt to just be able to express that and not think that it's going to have a horrible outcome or it's something that you have to hide as well in silence. So I think that's a really big part of this awareness and getting treatment early. It's going to be positive.
I think that's it, guys. Thank you.
Any other questions? If not, thank you for your attention and your support. Thank you all. We really appreciate it. Have a great day.